I'm Dr. Srinivas Gutta, consultant urologist and renal transplant surgeon at Yashoda Hospitals, Hitec City. Coming to robotic surgeries in urology, right from the inception, the usage of robotics was widely used in urological procedures, and we at our center also extensively we are putting robot to use for our surgeries. So predominantly all reconstructive urology work happens with a robot, and definitely, as all of you know, there are immense benefits of using a robot in reconstructive urology. The ease of doing a surgery, the speed of doing the surgery, and the end results are fantastic with the usage of robotics. So coming to reconstructive urology work like pyeloplasty or ureteric reimplantation, so we are finding very good results with usage of robotics in this area. And also when it comes to oncological work, so definitely robotic radical prostatectomy, the first choice of any urologist would be usage of robotics, and we at our center are also using robotics very extensively for robotic radical prostatectomies, and we are seeing very good results, good continence rate, good clearance rate, less bleeding complications with the usage of robotics. And radical cystectomy is again one surgery where I'm very happy in using this robot. So where again the ease of doing the procedure immensely helps, and also it reduces the amount of time that you take for doing, including any of the reconstructive work post radical cystectomy, reconstruction of a conduit or ureterointestinal anastomosis. All that happens with very ease with robotics. And coming to the kidney part, definitely yes, partial nephrectomy, robot plays a very major role in dealing with the partial nephrectomy. So again, the warm ischemia times are significantly reduced. The reconstructive ability with perfection happens with the robotic surgery. So to mention further, and usage of robotics has been put to use in our center for robotic renal transplant as well. Robotic renal transplants in obese individuals, a robot immensely helps in these individuals, because in an open surgery, when you are doing open surgery for renal transplants with a very obese individual, the vessels are quite deep and the warm ischemia times increase, and we find it very difficult for vascular anastomosis. But with usage of robo, the access to the vessels and the anastomosis happens much faster with this, and also the neo-ureterocystostomy also, robo immensely helps you in doing it quickly. So to summarize, majority of the today's urological procedures which can be done with laparoscopy can be shifted to robot, and because it saves your time, it helps in speedy recovery of the patient and reduces the blood loss, and the number of complications that arise out of any other procedure are grossly reduced with usage of robo. Thank you.